CARE International in Zimbabwe started operations in 1992 when we responded to a humanitarian disaster, droughts at that time. We are currently implementing projects in 5 out of the 10 provinces in Zimbabwe. So we have the capacity to respond to emergencies within 72 hours. And this is talking to our staff, the expertise that we have, the relationships that we have with the government of Zimbabwe, and our donors.
CARE International is celebrating 30 years today, and we are mainly driven with 3 main focuses of values amongst our staff. As we celebrate our 30 years at CARE, we are looking at how our staff have impacted in terms of the respect that we have given in our communities, the excellence that we have done in striving to work towards achieving our humanitarian work, as well as the commitment that we have done all over the parts of the world. As CARE International in Zimbabwe, we have reached over 3 million beneficiaries all over Zimbabwe, in and around the country, as well as the remote areas of the country. We have also reached people in places where it was not reachable through the commitment of our staff. We have been working towards the value of excellence as well as integrity in working with our beneficiaries. We value the work that we do as CARE International, and we also value the work that our staff does in doing the humanitarian work and also the commitment that they have been given. As we celebrate 30 years at CARE Zimbabwe, we would like to thank all our staff that have made an impact in the lives of the beneficiaries that are in Zimbabwe and beyond the world.
Sebasa rangu sa driver ndakafamba nzvimbo dzakati wandei dzatima project nadzo. Takafamba kwaita school feeding, tichiona vana vechikoro vachipiwa chikafu kuti vawane utano. Nekumagadheni takafamba futi tichiona magadheni aitwa neCARE International aita kuti vawane utano hwemuriwo, makerotsi, zvemugadheni zvakati wandei. Tichibva taendawo nzvimbo dzakaita sana Gokwe, kwanguri kusina yanga isiri nyore yekufamba ikoko because marodzi ikoko hakuna marodzi. Driver taiona kuti tingasvike sei kune vanhu vavo kuti tivabatsire kuti vawane chikafu, vawanewo matoilets akanaka. Vamwe vazhinji vacho vanga vasina matoilets. Sekufamba kwandakaita maprojects, ndakawana shanduko yakanyatsokura chaizvo kune vanhu vakati wandei. Sekuti project ichitanga ndaienda ndinoona kuti zveshuwa vanhu havana kana magadheni kana matoilets. Tozoenda pakati futi totoona vanhu vayashanduko yatovapo, matoilet vatovapo, vasupply wasimende zvese vakutofarawo kuti tatowana matoilets, tatowana nemagadheni, takutowana utano, vana vakuwanawo chikafu.
Tavaone mabathing room okugezera, tavawo vanhu vari mberi, tangofanana nevari mudhorobheni.
Ndinofara chaizvo neCARE International iri kusisa makore 30 years. Ndine tarisiro yekuti for the next years or 20 or 30 years vazhinji vanenge vane shanduko yakanaka.
And as CARE International in Zimbabwe, we do programming in both the humanitarian space and the development space. And over the years, I have seen CARE International's work changing and transforming people's lives in a variety and range of interventions, which includes education, water and sanitation, food security and nutrition, resilience building, and gender equality. And as CARE International in Zimbabwe, we have a humanitarian mandate. Due to climatic shocks, we experienced a drought in 2002 in Zimbabwe. And as CARE International in Zimbabwe, we responded to that drought by supporting 900,000 people in our areas of operation. So as we do our programming as CARE International in Zimbabwe, it's hinged on our gender equality framework, which focuses on 3 areas where we are, number 1, building agency of the people that we work with, where we change relations in the communities that we work with, and we also transform structures by way of contributing to policy reviews and their implementation. For the past 30 years, through our programming in the humanitarian and development space, as CARE International, we have seen people's lives changing. For example, through capacitating learners with 21st century skills around personal leadership development, where we are noting in schools learners taking up leadership positions at a very low level. For example, becoming prefects, peer leaders, role models and mentors, and even junior parliamentarians in our areas of operations. We are also doing village savings and lending associations with our communities, especially with our target group, where we unapologetically target women and girls. And we have seen women taking leadership positions in the village savings and lending committees, and also being financial literate, and also taking up income generating activities to scale. As CARE International in Zimbabwe, we have our signature models that we are currently rolling out in the communities that we work in the 5 provinces that we are working with. For example, the Social Analysis and Action Model, the Village Savings and Lending Association Model, which started in 2014, and we have been expanding this model in the areas of operations and taking it up to scale. And we are also supporting and complementing government efforts in the work that we do as the custodians of the communities we are working in.
We are this year celebrating 30 years of our work in the country, and we are looking forward to this week in particular get joined by many other actors in the development and humanitarian space. The past 30 years in the country, we have worked with a focus on women and girls. And what we have focused on is poverty eradication, because we believe poverty can actually be eradicated. We have focused on solutions that have impact. That means solutions that actually bring about real change in the lives of ordinary people that are struggling to make livelihoods. So we deliver our solutions in various ways, and particularly around this time we are focusing on 6 impact areas. We have a focus on food, water and nutrition. That's one impact area. The other one is climate adaptation and change. And the third area is gender equality, including education. So those are our top 3 priorities. We are also helping to respond in the area of women's economic justice, supporting women's startup entrepreneurship activities. And finally, the last impact area is health. And so the changes that we see now are people are more resilient, and resilience building is really a fundamental solution that we've been deploying as an organization. People are more resilient. That means when there's a shock, whether that is climate related or economic related or health related shock, people are more able to cope with their lives, but also actually, resist the impact of that shock. So to achieve all this, obviously we have a very robust team of staff that are on the ground. Zimbabwe is one of those countries in Africa that has an amazing pool of human resources. And CARE International in Zimbabwe is privileged to be working with excellent staff that are doing an amazing job on the ground. And so to carry this vision forward in the next 30 years, hopefully beginning now, we hope to stay within those 3 priorities that I've mentioned: food, water and nutrition, climate adaptation and change, as well as gender equality and education. We think that investments in this area, in these 3 areas, are very key, as they center around they center around saving lives, all the way to transforming livelihoods and lives. And so I think in that continuum of solutions, we want to make sure that now we can go to scale. And going to scale means going to more geographies, and so we are in the process of going to perhaps 1 or 2 additional provinces to our current 5. But also we want to work with more local organizations in the country, so that our solutions are more localized and more sustainable in that way.
It was a joy to experience the transition from the devastating effects to the recovery of communities. It was a joy to experience the transformation from people coming out of a crisis to a point where they are recovering. And I am glad to be part of that story.
I've been with CARE since 2015. I have been involved in 2 resilience projects, and I've seen CARE help improve the resilience capacities of communities through various resilience projects. I'm Brian Velani, and I'm part of the story.